Okay, the next item of business is a statement by Jenny Minto on gender identity healthcare for young people. The Minister will take questions at the end of her statement, therefore there should be no interruptions or interventions. And I call on Jenny Minto. Minister, up to 10 minutes, please.
Thank you, Presiding Officer. I want to start by speaking directly to our young people, and in particular our trans and non-binary young people across Scotland. I know these last few weeks and months have been incredibly difficult, with increased media attention and toxic online commentary. I understand how shocking, upsetting and destabilising the announcements last week and the public conversation around them will have been for you and your families. I want to reassure you that the Scottish Government remains absolutely committed not just to ensuring ongoing support is available for you, but to reforming and improving gender identity healthcare. This was a key part of the Butte House Agreement, and we will not waver in that commitment. Before I continue, I am clear that as a Parliament, we have a responsibility to protect and support minority groups. We are all human beings, we are all individuals, and we all deserve respect. It is vital that we lead by example, and the tone of our discussions and I hope that will be reflected in this session today. Let me reiterate what the First Minister has clearly said. The Cass Review is a detailed piece of work that requires thoughtful consideration. Last Thursday, NHS Greater Glasgow and Clyde and NHS Lothian, the two health boards in Scotland with specialist paediatric endocrinology services, issued a joint statement confirming a pause on new prescriptions for puberty hormone suppressants and cross-sex hormone medication for young people with gender dysphoria. This pause is to allow time for further evidence to be gathered to support the safety and clinical effectiveness of these medications following the Cass Review. The statement also confirmed that the small number of young people who are currently receiving these medicines will not be affected by this pause, mirroring the position in NHS England. As I have said consistently, it is not for politicians nor civil servants to make clinical decisions about clinical pathways. These decisions should always be made carefully, be based on the best evidence available and be made only by clinicians responsible for providing such health care. To be very clear, ministers do not make clinical decisions in any field of medicine, and gender identity services is no exception. I fully support health board autonomy in clinical decision making, and the commitment of clinicians to their patients in these services, alongside their wider multidisciplinary teams, is unwavering. Their focus is always on ensuring the treatment they prescribe is safe. Too often they face vitriol simply for doing their job, and it is important that they are supported too. I know some members in this chamber have expressed disappointment that the Scottish Government did not announce this position before the Health Board statement. Presiding Officer, every single one of us in this chamber, indeed every single one of us across Scotland, has a right to hear first and directly from the services caring for us if our treatment for any health matter is going to change. That is why it was absolutely correct that before making a public announcement, NHS Greater Glasgow and Clyde and NHS Lothian took time to speak to all the young people who would be impacted by this pause, so they understood what this meant for their care and treatment. I am sure that everyone in this chamber will agree with me that if this was happening to their loved one, that is exactly what they would want and expect to happen. I reiterate, these young people and their families must be at the heart of our decisions and thoughts when we discuss this issue. The NHS Greater Glasgow and Clyde Young People's Gender Service in Scotland remains absolutely committed to providing the best quality care for patients and referrals. The service will continue to provide holistic care and support to those accessing and referred into it. The Cass Review is a detailed, wide-ranging report, and I welcome the opportunity to update Parliament on our approach to the recommendations and wider work in this field. It is important to highlight that the Cass Review was commissioned by NHS England and did not review clinical services or pathways provided within the NHS in Scotland. Therefore, by definition, clearly not all the recommendations may be applicable to NHS services in Scotland. That said, it is vitally important that these recommendations are carefully considered to assess to what extent they are relevant to the approach to gender identity healthcare in Scotland and to decide upon what steps may need to be taken as a result. Time is required to fully consider all of the recommendations, something NHS England also acknowledges. We already have a strategic action framework for the improvement of NHS gender identity services. As part of this work, the Chief Medical Officer has agreed that the Deputy Chief Medical Officer and other senior medical officers will support careful consideration of the Cass Review's clinical recommendations and engage on these with the Scottish Association of Medical Directors and other clinical leaders. A multidisciplinary clinical team within the Office of the Chief Medical Officer in the Scottish Government, including paediatric, pharmacy and scientific expertise, will assess the clinical recommendations and engage with the relevant clinical community and leadership in health boards in relation to those recommendations. The CMO will provide a written update to Parliament on the outcome of that clinical consideration process before the summer recess. It's important to note that in Scotland we're already making progress in a number of aspects of gender identity healthcare highlighted in the Cass Review. So let me be clear, work has already begun and I will remain engaged throughout. For example, Dr Cass highlights the need to address increased capacity in services. The Scottish Government has committed to invest £9 million to support the improvement of NHS gender identity healthcare in Scotland. That funding will be delivered over a 5-year period so that national improvement work already underway will be embedded and built upon. This aligns with feedback received from health boards and third sector stakeholders regarding the need to support longer-term sustainability of service improvement. Since December 2022, we have invested over £2.8 million to support work to improve access to gender identity healthcare in Scotland, with over £2.2 million of that allocated directly to health boards with gender identity clinics. We will invest a further £2 million this year and a further £2 million in each of the next 2 years, and we are committed to long-term sustainable funding for these services beyond that point. We're also working with NHS Greater Glasgow and Clyde and NHS National Services Scotland to establish a nationally commissioned young people's gender service, part of ensuring young people's gender care in Scotland is as person-centred and effective as possible. The Cass Review recommends that gender identity healthcare must operate to the same standards as other clinical services. We agree. We have already commissioned Healthcare Improvement Scotland to develop new national standards for gender identity healthcare, and those standards are expected to be published this summer. A key focus throughout the review is the need for better, high-quality evidence in this field. We agree. Long before publication of this report, we provided the University of Glasgow with grant funding to establish a programme of research into the long-term health outcomes of people accessing gender identity healthcare. This includes 6 projects where the health outcomes of both adults and young people are considered, covering cardiovascular health, hypertension, sexual health, mental health and longer-term well-being. The outputs of these projects are expected towards the end of this year. In addition, the Scottish Government and Scottish Health Boards are observers to NHS England's planned study into the use of puberty blockers in young people's gender identity healthcare, and discussions are ongoing to determine what further involvement is appropriate. Presiding Officer, it did not take the publication of this review for us to start a broad programme of work to improve gender identity healthcare. In addition to the work that I've already highlighted, we have commissioned Public Health Scotland to develop a quarterly aggregate data collection for NHS Gender Identity Clinic waiting times, and we are supporting NHS National Education Scotland to develop new training materials for staff. Importantly, throughout this work, we've engaged with trans and non-binary people across Scotland who have lived experience of accessing or waiting to access gender identity services to ensure their voices are represented in our work to improve this care. Building on this, and in response to the understandable concern from those impacted both by this change and more broadly the provision of gender identity healthcare to young people, We will hold a round table with stakeholders representing those affected, and I will continue to engage directly with young people. Presiding Officer, I understand how difficult and heartbreaking the announcement last week will have been for the small number of young people and their families who were anticipating that they would soon be able to start these treatments. Dr. Cass reminds us in her report that a compassionate and kind society remembers that there are real children, young people, families, carers and clinicians behind the headlines. I hope that this sentiment is one we can all keep in mind today and as we move forward.
Thank you, Minister. The Minister will now take questions on the issues raised in her statement. Megan Gallagher.
Can I ask the Minister, when will parents and young people receive a meaningful update? And can she assure Parliament that all government ministers will follow the science rather than ideology? Minister.
I thank Megan Gallagher for her question. I would note that this has been a review that was commissioned by the NHS in England. We have worked with that review, but Scottish pathways have not been included in the review. The Scottish Government has clearly welcomed the report from Dr Hilary Cass, and I think what is absolutely clear is that the decision-making has been for clinicians to make, not politicians. And these decisions should be, as I said in my statement, always be made carefully based on the best evidence available. I am looking at this and putting the children and the families that are needing this support at the heart of the way that I'm working forward, and I'm getting the best advice I can from clinicians and stakeholders.
Jackie Bailey.
Now, we already have the National Gender Identity Healthcare Reference Group. Is the Minister bypassing this with something new? And if so, can she explain why? And finally, can the Minister confirm that she will suspend the commissioning of the Young People's Gender Service until the recommendations are fully considered? Minister.
I thank Jackie Bailey for her question. I repeat again, there are 32 recommendations in an almost 400-page report, and we are working through that at the right speed to ensure we make the right decisions. And that is from a clinical perspective, as I have said. As I said in response to Megan Gallagher, the Scottish Government welcomed the report. I have been reading it, and I recognise that Dr Cass is an eminent paediatric physician. I am listening to my clinicians with regards to this, and as I've said before, also the stakeholders.
Thank you. Rona Mackay, to be followed by Rachel Hamilton.
Thank you, Presiding Officer. We know how difficult this news must have been for the young people affected. What's vital now is that we focus on improving the healthcare of this very small number of affected people. And I note the Minister's comments about the steps being taken in this regard. Can the Minister say any more about this work and provide assurances to affected young people that this remains a priority?
Minister.
I thank Rona Mackay for her question. As I have highlighted in my statement, I have agreed with the Chief Medical Officer that the Deputy Chief Medical Officer and other senior medical officers will support careful consideration of the Cass Review's clinical recommendations. They will engage with the Scottish Association of Medical Directors and other clinical leaders. Some of the recommendations we're already doing work on. Others relate to specific challenges for NHS England, for example, around how contracts for commissioned services are managed. But let me be clear, work on this has already begun. A number of the recommendations will require much more detailed consideration regarding their relevancy to NHS Scotland systems and processes. For instance, recommendations around data systems.
Thank you. Rachel Hamilton, to be followed by Fulton McGregor.
I am here to speak directly to the young children and their families that have been impacted by this decision. I want to find the best way through for them, and that's why I'm working closely with the clinicians in NHS Scotland and also researchers.
Well done. Fulton McGregor, to be followed by Carol Mochan.
Thank you, Presiding Officer. This review is clearly important and very detailed and requires further detailed consideration. However, we must remind ourselves, as the Minister has said, that it does focus on services in NHS England and not NHS Scotland. So does the Minister agree that regardless of anyone's position on this matter, it is essential that adequate time is taken to consider the report and that any knee-jerk reactions, one way or the other, are avoided?
Minister.
Thank you, Fulton McGregor. As I've said, it is a 400-page report, and a knee-jerk reaction concerning a health system, a knee-jerk reaction on a report that concerns a health system different to Scotland's will not, in my view, be helpful for either patients or their families. That said, of course, it's vitally important that these recommendations are carefully considered to assess whether and to what extent they are relevant to the approach to gender identity healthcare in Scotland, and to consider what steps may need to be taken as a result.
Carol Mochan, to be followed by Claire Hawley. Thank
you, Presiding Officer. Can I thank the Minister for her statement and agree that it is right that we proceed carefully and compassionately. Can I ask the Minister, given Dr Cass's report is one founded on strong scientific evidence, and there were interim recommendations, so we did see what was coming to us in this Parliament, why the Government cannot be clearer in outlining its position on whether it believes all recommendations ought to be implemented?
I thank Carol Mochan for the support in recognising that we need to take time to review the contents of the report. As I've pointed out on a couple of occasions, this was an English NHS England commissioned report looking at England. Not all the recommendations link back to Scotland. That's why we're taking the time.
Claire Hawkey, to be followed by Alex Cole-Hamilton.
I refer members to my register of interest in that I hold a current NHS Greater Glasgow and Clyde Staff Nurse Bank contract. The people who should be at the front of our thoughts are the young people who are affected by this change. Can the Minister advise me what steps are being taken to support those young people and their families who have been affected, both those who are accessing and those waiting to access services, about their care going forward?
Minister.
I thank Claire Hawley for her question and bringing it back to those young people that have been affected by the change. In addition to the work that I've highlighted to contact and support young patients of the Sandyford Young People's Gender Service most impacted by the change announced last week, NHS Greater Glasgow and Clyde has engaged with people on the YPGS waiting list to identify any unmet needs. They're also working with third sector organisations to provide additional support, specifically for those who are on the waiting list for the service, as well as dedicated staff to act as conduits between those on the waiting list and expanded support. Additionally, the Scottish Government is already supporting NHS Greater Glasgow and Clyde and NHS National Services Scotland to consider how best to provide national specialist young people's gender care in Scotland.
Alex Cole-Hamilton, to be followed by Jackie Dunbar.
Thank you very much, Presiding Officer. We do need to remember the young people at the heart of this, many of whom will be in a state of profound distress. We need to get to a space where every one of them gets access to the quality care that they need. There are aspects of the report that some will find challenging, not least the stated lack of an existing evidential base for care pathways that have now been paused. There is therefore an urgent need to commission more medical research to promote greater understanding in this field. So what role does the Minister foresee for NHS Research Scotland and the Chief Scientist's Office in building that timely and comprehensive evidence base, ensuring both young people and their clinicians can make informed decisions about their care?
Minister.
I thank Alex Cole-Hamilton for his question and agree that, yes, it is a challenging report. As I highlighted in my statement, we have granted the University of Glasgow funds to do some research, but we also work very closely with the Chief Scientist's Office as well in this field.
Jackie Dunbar, to be followed by Gillian Mackay.
Dr Hilary Cass previously highlighted that increasingly toxic, ideological and polarised public debate does nothing to serve the young folk accessing this care, their families, nor the NHS staff who care for them. Does the Minister agree that it is vital that we all do everything we can do to take the heat out of this issue and redouble our efforts to deliver the best outcomes for young folk accessing this care?
Minister.
I thank Jackie Dunbar for her question, and I absolutely agree. As the First Minister highlighted last week, the toxicity of this debate is perpetuated by adults, and that's unfair to the children who are caught up in the middle. As Hilary Cass highlights, we must remember that there are real children, young people, families, carers and clinicians behind the headlines. We know that this heated debate not only impacts young people and their families, but clinicians, and interestingly, even Dr Cass herself. It is all our responsibility to take the heat out of this debate and put the focus where it should be, on the young people who need this care.
Gillian Mackay, to be followed by Ros McCall.
Many young people will be concerned about the effect of last week's decision to pause the prescriptions of hormones on their healthcare journey, and our solidarity should be with them. We need to work as quickly as possible to ensure that the concerns of the clinicians are resolved so that they can provide this care with confidence. Scottish Trans have suggested that we should consider setting up our own research study. Can the Minister outline what steps the Government is taking to resolve the current situation and how we can ensure that lived experience is at the heart of any action going forward?
Minister.
Thank you. I'd like to start by thanking Ms Mackay for her engagement on this and her shared concern for the young people most impacted by this change. As I highlighted in my statement, NHS Scotland are already engaging with NHS England's research study regarding puberty blockers and as an observer, and discussions are ongoing between clinical stakeholders on what further involvement may be appropriate. The Chief Scientist Office within Scottish Government is also involved, given their expertise in clinical research, and I hope we will be able to update Parliament on the outcome of these discussions soon. In addition to the NHS England research study, we have already provided grant funding to the University of Glasgow, as I mentioned to Mr Cole-Hamilton. Hearing from those with lived experience of accessing or waiting to access gender identity healthcare is vital. To support our national work to improve these services, we have put in place a lived experience coordinator to engage and consult with trans communities across Scotland. And as I laid out in my statement, I remain absolutely committed to my own engagement with young people affected.
Ros McCall, to be followed by John Mason.
Thank you. The Cass review highlights the clear acknowledgement of detransition, and it's as a growing phenomenon that cannot be ignored. In fact, it was mentioned in the report over 80 times. I noticed from the statement today that the Chief Medical Officer and the Scottish Government will take time to assess the recommendations, which is yet more time in an already lengthy period, as detransitioners have largely been ignored, often victimised and repeatedly castigated. So may I ask the Minister, is detransitioning included in any of the work already commissioned by the Scottish Government? Will it be included in any additional work commissioned, including the roundtable that the Minister has mentioned in her statement? And when will Parliament be updated on plans to support detransitioners?
Minister.
I thank Ros McCall for her question. As I noted, the Chief Medical Officer has agreed to update Parliament by writing on the clinical side before summer recess. Detransitioning, given that we're talking about what was contained in the Cass review, detransitioning, I think, should be included, and I will ensure that I feed this back to the Chief Medical Officer to ensure it is.
John Mason, to be followed by Sue Webber.
Thank you very much. One of Dr Cass's main criticisms of the system in England was a failure to reliably collect even the most basic data. And also she said that NHS adult gender services initially refused to cooperate in sharing data. Can the Minister assure us that that is not the case in Scotland?
Minister.
So I thank John Mason for his question. I cannot comment on specific data systems or collection in NHS England Commission services. However, we are committed to improving data collection for gender identity healthcare in Scotland. As I mentioned, Public Health Scotland have been commissioned to develop quarterly aggregate data collection for NHS gender identity clinic waiting times, focusing on a number of new referrals and length of wait from initial referral to first outpatient consultation with a specialist. Whilst this is a technical commission, the detail of which is being worked through by Public Health Scotland and territorial health boards, Public Health Scotland currently intend to publish the first of this information in late summer 2024.
Sue Webber, to be followed by Michelle Thompson.
Thank you, Presiding Officer. As the Minister will be aware, the Education, Children and Young People Committee wrote to the First Minister about the Cass review last week. We called for a clear timeline to be established for a Scottish response to the review. The committee also called for a comprehensive children's rights and wellbeing impact assessment to be carried out, and this is because we recognise the Cass review raised some very complex and sometimes competing children's rights considerations. Will the Minister undertake to carry out such an assessment? When will this be done? And how will she ensure that this fully explores the rights of children and young people across Scotland?
Minister.
I thank Sue Webber for her question, and yes, I am aware of the letter that she sent. I have actually responded to her colleague Megan Gallagher's letter this morning and copied that as well as to the Health Committee, also to the Education Committee as well. I will take some time to have a look at the contents of her letter along with my colleagues in Education and will respond in writing.
Michelle Thompson, to be followed by Pam Gossel.
Thank you, Presiding Officer. The Tavistock Clinic based in London is facing mass legal action claims where some young people felt they were being rushed into a medical pathway. Given that the Sandyford Clinic in Scotland uses the same guidelines, what assessment or indeed discussions with NHS bodies have the Scottish Government had as to the possibility of that similar legal action occurring in Scotland?
Minister.
I thank Michelle Thompson for her question. I have had no discussions on this topic, but bear in mind what she said and will respond to her in writing.
Pam Gossel, to be followed by Ash Regan.
Thank you, Presiding Officer.
Minister.
I'm responding as Minister for Public Health and Women's Health to Pam Gossel's question. I am focusing today on ensuring that the children and the families that have been impacted by the decision this last week and also the clinicians get the right support to ensure that we make the right decisions and get the best gender services that we can have in Scotland.
Thank you. And Ash Regan.
Thank you. Given the importance of this issue, the public would rightly expect that the First Minister or the Health Secretary would be making this statement. On the 28th of March, I asked the Health Secretary to pause puberty blockers in Scotland, and now it seems that the Cabinet Secretary was unaware that clinicians at Sandyford had made the decision to stop in mid-March. Can the Minister confirm when the Government will be scheduling a full debate on the comprehensive findings of the Cass report and its many implications for health, for education and for law in Scotland? And listening to the Minister today, it seems as if the Government has not read or not absorbed Cass's conclusions. Is the Government really saying that they do not accept the recommendations in full?
Minister.
I thank Ash Regan for her question, and as I've pointed out in previous answers, this was a report commissioned by NHS England looking at services in England. As a result, not all recommendations fit with the way and the pathways that we have within Scotland.
Thank you, Minister, and thank you, members, for your cooperation. Point of order, Rachel Hamilton. Thank Rachel Hamilton for her point of order. As she knows, the content of members' contributions are not a matter for the Chair. And with that, we will pause briefly to allow front benches to change before we move on to the next item of business.